A root canal is what we call the inside of a tooth that contains nerves and blood vessels. Just like the outside of a tooth can develop a cavity and require a filling, the inside of a tooth may become infected and require a root canal treatment. A root canal treatment is really often the last resort that we have to save a tooth from being extracted. There are many reasons why a tooth may become infected, but the most common reason is because the decay gets too deep in a tooth and then the nerve gets infected from the bacteria. This often presents as a throbbing pain, which may keep you up at night, or it may present in the earlier stages as a little bit of a milder pain, so it might be sensitivity to hot or cold foods or drinks, or pain when you're biting or chewing, or a bit of soreness that comes up around the gums. Once your tooth becomes infected, there's not really any other options to save your tooth free of pain and infection other than a root canal treatment. The only other option that we have is to extract your tooth, which gets rid of the infection as well. It's not really an option to leave the tooth in place because the infection can spread. You might end up with some facial swelling or spread of infection, and you may require emergency treatment. So getting a root canal treatment is much like doing a modern filling, but rather than working on the top of the tooth, we work on the inside of the tooth. So we get rid of the decay from the top and we clean out the inside of the root canal system, we get rid of the infection, and then we fill the tooth and we seal it off. That usually takes multiple appointments, so 2 or 3 appointments to achieve. But the flip side of that is that you get to keep your tooth free of pain and infection. A recent study shown that about 87% of teeth that have undergone root treatment are still in the mouth 10 years after treatment's completed. Root canal treatment often gets a bad rap from patients because by the time they come in to see us for root canal treatment, they're in considerable pain. Following the appointment, most patients tell me that it's really no different to having a filling done.